I'm joined by Terry Cunningham, Director of the Administrative Simplification Policy at the American Hospital Association. Terry's a panelist at our upcoming Patient Access Program, where he's joining the panel on prior authorization. Terry, thanks so much for joining us today.
Thanks for having me.
To get started then, could you share with us just a little bit about your professional background, how you got your start in healthcare, and what's brought you to your role now at the American Hospital Association?
Sure. So I'm born and raised in Chicago. And as a kid, my brother was in and out of hospitals. So I gained a particular appreciation for providers and doctors and, the provision of healthcare and, what that means to families and stuff. So I went to college at the University of Iowa with aspirations of being a physician until I took a science class. And then I realized it's not for me. So things led me to law school. And during law school, I still had that appreciation for healthcare. And I ended up moving into health policy. And so I worked for about 9 years with the American Medical Association in various roles of health policy, and then including administrative simplification, some of the stuff we're going to talk about today. And then about 3.5 years ago, I moved to the American Hospital Association to take a leadership role in that same kind of area. And so that's kind of how I got into healthcare. It's really wanting to be part of the system, not being fit to be a physician, but being able to help in other ways.
Well, and I think that that's such a relevant point and something that is shared by so many people in patient access and in revenue cycle. They want to help others. They want to, be part of this system that cares for others, but perhaps not in a clinical capacity. Tell us then a little bit about your work with the Administrative Simplification Policy. We've got you joining us on our panel on prior authorization, and this is a really interesting policy that could have great benefit to the industry. So tell us a little bit more about it.
Sure. So, the concept of Administrative Simplification Policy, which is admittedly a mouthful, kind of came out through HIPAA. And so HIPAA had an idea of there was a lot of different health plans that providers were interacting with, and it was difficult for them to have to do things differently for each individual health plan. And so HIPAA kind of streamlined that process. And so, your claims process is extremely efficient because everyone can submit the same kind of claim and stuff for everyone, for all payers with whom you're interacting. Unfortunately, prior auth never really did get, even though it was kind of named as something that was a goal of HIPAA, it never really did get ironed out appropriately. And so, the goal of administrative simplification is, again, streamlining this stuff. And for years, that's kind of been the elephant in the room. Maybe that's not a great term, but really trying to figure out how do we address prior authorization? Because of all the transactions that are simplified, prior authorization is the one that really has a direct impact on patient care and a patient access. And so some of the care and some of the reasons we've been working so hard in this policy is prior authorization does have a lot of negative impacts. The provision of prior authorization can have a lot of negative impacts on patient care. I'll reference an AMA survey that came out earlier this year where 94% of physicians said that prior authorization has delayed care for their patients. And perhaps more alarmingly, 80% reported treatment abandonment. And you can imagine what will happen there is if a patient goes to fill a prescription and then the pharmacist says, you've got to get prior authorization. You got to come back in a week once we get this ironed out with your doctor and your health insurer. A lot of times the patient might just say, heck with it, I'm not going to get that. Or, they might not have time. And so it really directly impacts their care. And so from a provider standpoint, on top of the primary thing is this impacts patients, it's also a huge resource burden for providers. Providers are spending a lot of resources trying to navigate the different ways people want them to do prior authorizations, including fax, phone, and all these inefficient ways. And these are a lot of navigating these idiosyncratic payer processes. And there's better things that providers should be spending money on, such as patient care. So if we can streamline this process, which again directly impacts patients, we can enable providers more time to be spending with their patients, more time to be spending resources on dynamic patient care, and less time on just kind of these paperwork that is just an inefficient. So I think the standardization and the administrative simplification for prior authorization, perhaps more than all other standards, is such an important thing that we have to work towards. And I've been encouraged by some of the work that's been coming out recently.
I couldn't agree with you more. Certainly our audience are talking constantly about the challenges that they're facing in securing prior authorization. And recently I met with some friends who they asked about what do I do and what do I think is the biggest challenge in healthcare? And I said prior authorization. And they said, well, what's that? And I explained just briefly, you need to have authorization for your service. And every single person at the table had an example of something that had been either rejected or declined or delayed. And it is just such a pervasive challenge across the industry, and every provider or every payer having a different system only just escalates the difficulty.
Excellent.
We're really looking forward to that patient access event that you're joining. Tell us something that you're looking forward to either benchmarking with the audience or hearing from during the meeting.
I mean, what drew me to the meeting was, again, right up front, it's the patient access meeting. And I think that's the lens that I think prior authorization should be looked at, because there's a lot of different ways. We can, cut down costs for the system. And those are important, legitimate issues. But the fact that prior authorization can directly harm patient access to care is such a huge issue. And I like the fact that this is kind of taking that lens, looking at this is a patient access issue. And so really kind of love that. And again, just the mission in general of the organization with, I think I read on the website, it's basically the mission is about utilizing innovation to address some of the financial strain that providers are facing. And God knows after the pandemic, man, the providers are facing a lot. And we've seen quite a bit of providers struggling because of, some various financial issues. And so I like the idea of how do we leverage some of the innovation in the financial space to really address those issues. In terms of selfishly, I think I'm most excited to hear from others on the prior authorization issue, because that really is what I live, breathe, and everything. But I'm just excited to see it's such an impressive panel of different people presenting throughout the day. So I look forward to the opportunity to just kind of soak in from everyone and participate with some of the extremely impressive colleagues and co-panelists with whom I'll be working.
Well, we really appreciate you joining that panel, and we look forward to it.
Thank you so much for having me. I really
Thanks
look forward to it as well.
Thank you.